Can you have an agent that makes you to feel that way? And then B, we've seen of B, we're having with grandiose ideation. I think this is the one that's going to to make us eliminate it. The drugs, but this illegal brews. That's when you're going to feel great. Yeah. Unatembea everyone, these nakaa systemic signs, and then it's simply something called violence, combativeness. Yes. Okay. So actually, this has at least some aspects that are pointing to contrary opinion. Can we CTD? Alafu pia incomplete BP, incomplete blood pressure. It's not really making sense. Blood pressure is not really making sense. Perhaps it could have been more been making sense. So can we sit with choice? The sun. Are you allowing me to read the next question? Points towards opioid toxicity, and other options you can as well eliminate. You can as well as a sign of any toxicity. So I would also urge you, treating sometimes is difficult, especially when you are moderating. So Regi, Kati, I hope you've heard what I've said. So number 9, in DSM-5 manual, schizophrenia spectrum and psychotic disorders classificational disorder. It includes which conditions? Acute stress disorder, autism, hoarding disorder, or delusional disorder. Disorder. These disorders. So usually we also have like schizophreniform. We have schizophreniform. We also have related disorders like schizoaffective. From the word itself, there are a lot of emotions involved in that psychotic. For schizophreniform, the symptoms should be there for how long? For schizophreniform, the symptoms Brinham's are shared as so psychotic disorders. Be there for how long? Actually, we brainstorming. Zinafaa ziwe there for how long? We need to differentiate all these disorders. And what about schizophrenia? The symptoms now this according to the time. Now, zikipita 6 months, we're going to, yes, schizophreniform, but the duration of the symptoms. And schizoaffective is majorly differentiated by the symptoms. For schizoaffective, as much as we have such type of ills, your lines in, so it's majorly it has more of the false beliefs. I think with that, it's possible to understand them, to manage those to be. Ni mimi naona to be. Ni mimi naona getting me 6 months and squash it. And we will really wish you the best in the kit. And we will really wish you the best in the care of that patient. So can you sit to the next question? I wanted to talk something about antipsychotics, but for the interest of time, you can just encompasses more as for the interest of time, you can just encompasses more as much as you have psychotic symptoms. You also, from the word affective, from the word affective it also has more of the emotional aspect, both the mood and the thought, both the mood and the thought, the mood and the affect, delusions, hallucinations, disorganized speech, grossly disorganized, catatonic negative symptoms, and you also have major mood episodes affective as much as rates the drug of choice, the drug of choice, the drug of abuse with the highest potential for physical dependence includes opioids, cannabis, LSD, cocaine. The highest potential for physical dependence. Which one is it? Let's talk about positive and negative symptoms. Okay, Vicky. Positive symptoms are constant. Those are positive symptoms. But negative symptoms, those are positive symptoms. But negative symptoms are those the ones that have A in it, and we also have other aspects. For example, affective flattening. Yeah, to go with choice A, opioid analgesics, opioid anhedonia, inability to feel pleasure. Thank you, guys. Opioid analgesic. And which one is the strongest? Which one has the highest physical dependence among the objective of an opioid analgesic is more uh, addictive, addictive. It is fentanyl. It is LSD stand for what? Stronger than morphine inashinda or something. You can at least LSD stands for what? This morph chemically associated with the chief adjunctant during anesthesia. Fentanyl. Fentanyl. The chief adjunct. The chief opioid adjunct. The chief opioid adjunct in anesthesia. Let me get the next question. The commonly associated. The commonly associated. Not really associated. They are the second. Not really associated. They are the second generation. Bag fentanyl. Bag fentanyl. You should also note effects. Organ syndrome, neuroleptic strategy, hypertension screening, hospice care. The development of the following program is likely to be hypertension screening, smoking prevention. Provident, I was here. Where were you May last year, 2024? Yeah, you are still perhaps. That's when I did my NCK. So I'm an elder. I'm also an elder. Please give me the respect that it demands. So Aten is sawa na benzotropine. Aten it's that is a what? How do they call it? It is not really a trade name, a generic name. Yeah, it's another name for benzotropine. So which hand are we sitting with? Primary prevention. Actually, they were just asking for an example. Choice will tell you that this is a primary prevention. Support group, that is rehabilitation, and rehabilitation is tertiary prevention. Case of primary prevention. What is primary? The risk factors. If smoking is the risk factor for primary concentrate on the risk factors. They entail early screening and also treatment and early treatment. Screening and early treatment. Yeah, modicate ni flow. So I hope tumemalizana mambo ya psychiatric. Yeah. Can we see for the cities? Hi, Nemo. So the next question, number 12. One of the following is an important emerging challenge to change in immigration, increase in bioterrorism. Is an important emerging challenge to change in healthcare. Emma, I really pity you. You should be conversant with all the three names, the trade name, the chemical name, and also the generic name. Utakuwa safe. At times they confuse. You should know. So you need to have that in your. So I'm seeing everyone is going with number 12B, but Kat is going with D. Kat iko na majina nyingi sana. To take note of that, very good for your thing here. The modern emerging, something that has not been there, something that's not common, but it's now emerging. A challenge to change in there before. That's what the question is asking. Emerging. If you hear of emerging trends, something emerging challenge. Yeah. Na mmeona hata saizi America and is shortage of also bioterrorism. Something bioterrorism is simply the threat or use of biological agents by individuals or groups of biological agents by individuals or groups calculate fear more more was COVID-19 a form of bioterrorism? I remember during that time there were a lot of ideologies. There are a lot of they were stereotyping things, and then I don't know if those myths were really true. If I don't know if those myths were true or they were just false misconceptions. It could also interfere with your sexual health, especially for men. Yeah, that it was also a way of controlling population. Yeah, everything you do, they yeah, everything you do, they monitor. And some say that it was an agenda. Some say that it was an agenda. Mm. So because the reason being, I don't know why, but sisi wenye tulipata vaccine, I don't know, for our clinical nation certificate, and we were forced to vaccinate. So can we see to sasa sisi wengine hawakuvaccinatiwa, they are safe, but some of us are still na tulisema tutaanza kuanguka kama kuku. Those conspiracy theories. We are healthcare workers, so if we're still holding those beliefs, how about our common mwananchi? Yeah. What number 13 reads? Number 13 reads, a nurse manager has 20 of staff. The manager decides to manage with 3 remaining nurses, which keeps the unit at minimal staffing standards. The type of decision-making strategy adopted is routine adaptive rationalization shift. Because of reduced availability, the manager decides to manage with the 3 remaining. decision-making strategy, routine, adaptive, rationalizing, satisfying. Naona RST going with B and types of decision going with B. And we also have C. So we also have C, Abu Dhabi, MSC, Brazil that I'm not seeing it is there. So can you get something to go through? Can you get something? Can someone share analyzing resources? What about rationalizing? What trying to explain the other aspect of thing, why it is happening that way. It's like trying to just create logic out of everything that is happening. Not that you are applying action for rationalizing, but you're just trying to come up with that, but not putting action in place. Yes, that is a flashcard set question. It's also in support of bioterrorism. Thank you, Rambo, for that. So can I have silence? I would actually not wish to add something there unless someone wants to. Let's know how you're reasoning, your mind. Let's also understand your faculty of imagination.
Yeah, thank you, Senior Stan. I'm not very sure the question by these two being at a minimum stage. So from the word rationalizing, I know that this kind of thinking is working with minimal resources. You rationalize the resources you have. Let's say you have 1,000 bob and you have 1, 2, 3 things to do. So you'll have to rationalize the resources you have to keep things moving at a minimum. So that's my school of thought, but I could be wrong. Thank you.
Okay, thank you so much, Manu. We really wanted to hear your side of things. But in this case, this person, for rationalizing, you just provide that way. So perhaps angesema sense. But in this case, how do you see it? I'm actually thinking in the line of the thought process of Kati. Yeah, is trying to use the available stuff. I've been rationing, not rationalization. So the issue is that I haven't got anything to read up on. Don, do you have perhaps something that you can share with us on decision-making strategies? More resources. And resources goes all the way from material resource, manpower, and also have material, money, and manpower. Yes. So trying to utilize what is available. Yes. Time is money. Exactly. To challenge us, to challenge adaptive, or where are you going with the evidence, Emma? So in some contexts, in this form, you can also apply. You can allow me to sit here with the menu of choice. Routine is like actually scheduling. Routine is something that you like. Let me say something that you should be doing every day. A norm, whether necessary or not, everything should happen as it is supposed to be. Of A as a near answer, neither would I think of choice dissatisfying, because what we are realizing is minimal staffing standards, minimal. To say that is satisfying. So what also, all right, we settled with choice B. I hope we all agree with choice B. Thank you so much. And just has shared something. Decision is routine, virtually automatic decision making that follows established rules or guidelines, something that has already been planned, and there are no rules to follow since the decision is new. And then you also have decision making styles, directive, using minimal information and consider few alternatives, analytic, making careful decisions in unique situations, conceptual, maintain a broad outlook, and consider many alternatives in making long-term decisions, and then have behavioral, simply avoidance. So I think we've missed something on what we wanted, but I think this one. What instance tunatumia rationalizing decision making? So decision making, rationalizing, sometimes it's justify what is happening. You're just trying to justify. Yeah, it's just a form of defense mechanism as much as I can know in this psychiatric context. So I also think it means the same for this case to share with Lai. So let me get question 14. May I get question 14? Naona D. Rambo, I hope uko sawa. Rambo. Rambo, are you okay? Might so Sanera. Just confirm if you are okay. If not, sioni any response. So let me we're just using some funny usernames. So it's good to be gender sensitive. So if he or she comes, number 4 having evidence is A. Drying and placing the victim's clothing in an individual evidence bag. B. Identifying the nature and origin of the injuries. C. Thorough cleaning the victim's skin. D. So 14, I'm seeing Alan going with A, Karesh A, Sandra A, I also have Miss Queen A, Brittany also going with choice A, Mali A, Rawan A, Rita A, Jimmy A, Aisha A, Unique A, Mukami A, Water A. Mary, please stand by your work, Mary Owino. If you're the new in the church, we want to welcome you. So we always encourage people to number their work so that at least in case someone follows the charts later, he or she can know which number you are tackling, you are answering. So I'm seeing A, and then we also have Rotich is going with choice D. Amy also going with D. Na pia kuna B from Wambo. Yeah, kuna B, D na kuna A. Jungle Boy has shared something. So Jungle, in case will give us 14. So this is an evidence that can come in during an assault case. What is the first step? So nimeona Wambo has shared something. So let's finish this evidence. Should you dry? Actually, for all these cases, kuna something that you can eliminate. Actually, you should preserve everything. And that individual evidence back inakwanga seed. It's like a nylon. So even actually seeing something controversial with choice B, yeah, C, you should not do it. Kabisa, don't thoroughly clean the victim's skin, and also conducting law enforcement. No, why should you conduct the first step? What is actually the first step? But is it going to happen fast? The priority here is the patient. The priority here is the patient. So make sure the patient is safe first, and also examine the nature of the injuries. You can also check of the patient uh, before you even do what? Call the police. So what do we say? What do we go with? What do we sit with? We sit with ilikuwa poa, lakini sasa wameharibu kwa kusema you should dry. You should dry. Yeah. So sijui Rambo shared something. Rambo, what's the source of this one? Rambo, what's the source of this other choice? The right answer is C, but identifying the nature. We need to identify first. You need to identify. Actually, recording is permittable, but it should be as per the. Also, you should also respect client's wishes. Yeah, uh, so Emma, you have something to share? Emma, let me invite you to unmute your mic. You can. Kuna majina kweli. Types of evidences. We have oral evidence, direct evidence, documentary evidence, real evidence, indirect, circumstantial, and also hearsay evidence. So bloods, semen, and then you also have firearms and ammunition evidence. Like for example, if there are guns, bullets involved, shells, you need to collect them. Yeah. So you can also go through that at your own time. For the sake of time, I just wish you to go through that. Yeah. Yes, you can unmute Emma. You can unmute. If you're in the chat, but we can't hear you. Okay, so let's see to its choice B. Learning is taking place in the former question. We want to see what the flash code provided as the right answer. They are not typed appropriately because I've seen something. It is satisficing, not satisfying. Yeah, satisficing. So, Jungle Boy.
Hello, I hope everyone's getting me. Hello. Okay, on question number 13, from the initial time, this says that's fine, but it should be satisfying. In that, in this case, you're having a shortage. But what's the minimum number of nurses that are required to manage a ward? Actually, it should be 3. That's the bare minimum that should be carrying every other shift. Before shift as a manager, unafaa kuwa watatu so that you can handle that ward. So in this scenario, even if there is a shortage, but they are not below the threshold.
Input Jungle Boy. I hope you've heard him. Yeah. We now sit with this choice. Let me now give me sit. I think there was spelling error for that choice. Hata nimesikia hiyo ingine pia we have a spelling choice, spelling error. So Sharon has shared something. Satisfice means to decide on and pursue a course of action that will satisfy the minimum requirements necessary to achieve a particular goal. Thank you so much, Sharon Biwot. Yeah, you can see even the definition of it also convincing us more and more. Can you do one more question? We reach question 15. It's already time, right? Rambo, we really appreciate. Let's appreciate Rambo. So I don't know if we should do the nurses in Ward X are in conflict with the physician regarding when vital signs of the patient should be taken in the afternoon. As the unit manager, kind of communication between physicians and nurses, accommodating positive criticisms, defending the nursing profession from interference from none. It doesn't require more critical thinking. Yes. Someone had deleted something here. I was trying to read through it. Is it water? Water, please evidence. I'm so allergic to people deleting evidences. I'm so allergic to people deleting evidences. Please. Not very difficult, but not difficult. Yeah. Huku kwa ground ndio choice B. So the best decision making conflict resolution style, the best conflict resolution style is what? It is what? As we wind up, which one is the best? Let me give you the options. Among compromising, avoidance, accommodating, those four. Accommodate, yeah. Compromising, yeah. Compromising is the best. Okay, so up to that moment, I want to wish and everyone the best. I want to thank Elon a success. I also want to thank in particular, I think Mimo and Kathy have been helping me to forward the questions, and also our Shishi and also Tibag. Tibag have been updating for us. And let's also thank Tracy, who also participated in moderation evidently. And let's acknowledge her. Alikuwa anaitwa nani? I think Ham very well. I think the first time namuona, but we encourage that spirit. We want to encourage that spirit, so that we all participate lively and make a session. Tumia pia. Oh, Hams, you've been there. Oh, we acknowledge, we recognize you though. I think you perhaps changed your name. So we stop at that point. Nara, so let's shift to me twice. Meanwhile, I'll urge party, Kathy just forward the NCK timetable for people not to confuse. Let it be clear of the exam when the deadline of the mock is 14th. That so that someone who is just coming in, it may be clear for them. We can shift. Let me end the chat.